Hi, my name's Anya and I'm an Oxford medical student. Today's video is going to be about personal values. Make sure to hit like and subscribe if you enjoyed this video.
Medical staff will often advise you to be confident. How can you build confidence as a medical student?
As a medical student, I think it would be natural to feel unsure. We're still learning and having lots of new things thrown at us. But I think the best thing to do to build confidence when we might be feeling nervous is to try and be as best prepared as we can. So we could take the example of, I think blood tests is something that you learn at the beginning when you're a medical student. If I was really nervous about not knowing how to take a blood test and it's a really key skill that I think I want to know, I would first of all highlight that and think this is my aim, this is what I want to work on. So identify where I'm feeling less confident. And I would then go away and I would research, I would use YouTube videos, I would use medical textbooks so that I can understand what a blood test involves. For example, what equipment would be needed and what are good techniques to do that. I would then try and take this practically onto the ward, and I would signpost to a colleague, for example, a phlebotomist or a nurse or a junior doctor, and say, I'm not feeling very confident in my blood test and I really want to work on that. Do you mind if I observe you completing some blood tests? And so at the beginning, I would observe them taking the blood tests, ask them to talk it through with me, and me ask any questions that I'm feeling unsure about. I would then ask them to supervise and watch me perform the blood test and ask for any feedback, and importantly listen to that feedback and make the changes as a result. And then I would try and gradually transition from doing supervised work to becoming unsupervised, where I'm feeling confident, I've had all the practice and I'm ready. And then potentially even starting on, I think some veins might be easier to take blood from than others. For example, if I can see a prominent vein, I would start off with that looks easier. And then once I've got my confidence even more, gradient and transition into those harder cases. So I think overall, as a medical student, you're not going to feel confident 100% of the time. And I think it's really important to be as best prepared as you can. Do your research beforehand, because the more knowledge you have, the less nervous you're going to feel. Ask for support when needed, and ask for mentorship and feedback on said skill, and then work from there.
You are the senior surgeon tasked with a total knee replacement operation. How would you manage the multidisciplinary team to ensure the operation runs smoothly?
So as the senior surgeon in charge of this multidisciplinary team, I think my first thing would to make sure that everyone is on the same page, our communication is great, and everyone knows what is about to happen. So I would start off by having a meeting. I think I observed one when I was on work experience, and it was really effective with communication, making sure everyone was on the same page. And so I think first of all, as the senior, I would outline the procedure, identify our patient, and importantly, identify what we are going to do and where. And I think I've even sometimes seen markings on and really obvious signposting about where the surgery is going to take place, just to eliminate mistakes from that point. And I think we would introduce everyone by name and by role, so everyone knows their role. Everyone who has the expertise can input what they think needs to be told to the whole group, and so everything can be as prepared as possible. So for example, it could be a scrub nurse talking about what equipment is needed for that specific surgery and making sure we have all of the equipment available. That could be the anaesthetist who has already spoken to the patient and they make sure they have all of the drugs available that they think are going to be necessary. Is it that the porters have been told when the surgery is going to take place and where the patient is located and when they need bringing in? So I think one of the main things is about communicating everyone's roles to make sure that everything's in place. I think I've sometimes even seen checklists followed of making sure we methodically go through everything, and as the senior, it's important to make sure that all checklists are followed and that in terms of safety, we are practicing safely and there are procedures in place if things start to go wrong. And I think on that front as well, it's also really important to be adaptable as the surgeon and as the senior in control, because things might not always go as planned, and importantly, just like the safety, that we are adaptable and we do know what's to happen in what situation. So I think overall the most important thing is to communicate effectively, make sure all roles are explained and everyone is on the same page so that our patient receives the best and the safest care.
Should doctors who encourage herbal remedies for respiratory infections be allowed to practice?
As doctors, the most important thing is that we practice evidence-based medicine. And so that is that we are giving our patient the best care that we know, whether that be from research, from clinical trials, from patient population data, from epidemiological data, and ensuring that our patient is best informed of this evidence so that we can have a plan. I think in relevance to the herbal remedies may not be as well researched as the drugs that are prescribed and licensed by the NHS specifically. For example, we could be unsure of dosage, if in certain doses that it could be really harmful. I think the most important one as well is interactions with drugs that patients may already be on. Because herbal remedies are not used as widely, the understanding of how it might work with specific medications, which could be integral to someone's healthy life, is really important to understand. But I think it is also important to consider the patient's viewpoint and respect their autonomy. If a patient has actively researched a herbal remedy and that is something that they would really like, and it could work alongside the treatment that is evidence-based that you as a doctor has prescribed, then I think it's all about collaboration and working with the patient to reach the best management of the clinical decision making. So I think overall, to conclude, doctors should, if in the correct and if appropriate when spoken to with the patient about expectations of the herbal remedies and how they may work alongside the drugs that they are on, if that is a shared decision that they have made, then doctors can recommend some herbal remedies alongside the medications. But it's always important to manage a patient's expectations, and that using herbal remedies alone should maybe not be completely encouraged.
During a busy week of revision in preparation for medical school exams, you are approached by a fellow student who is struggling to interpret a chest x-ray. What do you do in this situation?
So the first thing I would do is really acknowledge and show empathy to the other medical student. Chest x-rays can sometimes be really hard to get your head around. And so I would say, I struggled with x-rays to begin with. And then I would signpost them to resources that I personally found helpful. For example, if that is a specific textbook or a specific YouTube video that's given by a medical professional, then that's what I would start off with and say, this is what helped me. I would also want to assess my revision time for my exam before offering any further help. I'd want to understand, have I got other revision plans in place? Am I feeling confident on the chest x-rays, or would it actually be helpful for us to collaborate? I think a really good way of learning is actually by teaching other students, because you learn yourself what you understand, and finding a way to explain it in simple terms is a really good skill to have as a healthcare professional. So I think for me, in my case, I would probably say, let's arrange to meet at a lunchtime. Once you've gone away and read and feel a little bit more confident, we could then discuss cases through. So it's not only helping me with my studies, it's also going to help them. So I think overall, I would be empathetic and show that I appreciate I really struggled with chest x-rays, but let's work together through this and collaborate together, and we can both hopefully improve our skills in chest x-rays.
You are on a train and you witness an elderly man having a seizure. What do you do?
So if I was the first person at the scene, the first thing I would want to do is assess the danger around, if there is any hazards around, and then I would approach the man on the floor and put them into the recovery position. That would be my first aim, to get them as safe as possible. I would call for help see if there are any other passengers on the train, and see, whilst I am helping the man on the floor, if they could call for an ambulance or call 999 or for anywhere, see if there is maybe a doctor on the train if the train is moving and it's not reached a station yet. And then I would try and talk to the man on the floor, see if he is able to communicate, really reassure him, show empathy, and really communicate that I'm here, I'm with you, I'm trying to help you, we've called for help, help is on the way. Is there anything that I can do? For example, I could look to see if there's a head injury or if there's any bleeding, something where I, as not having complete medical qualifications, would be able to assist. Is there a bleed that I think I could maybe put compression on to stop any bleeding? I think acknowledging that I do not have the complete medical qualifications to offer much medical advice, but to help as much as I can in the constraints of the knowledge that I do. Also, maybe if the man themselves wanted me to contact their family, if there was a passenger on board that knew them, that could help communicate with their family. So I think overall the most important thing to do is to try and make sure that the man is as safe as possible and that help is on the way, but also showing empathy and offering any support, and if there's anything that you can do for that man in that situation.
Do surgeons need to be empathetic?
All healthcare professionals, in my opinion, need to be empathetic. I think empathy builds a really great patient rapport, and it helps make sure that the patient has the best healthcare outcomes. In reference specifically to surgeons, I think sometimes there can be a stereotype that surgeons don't have much empathy. But I think it's really important that they do, and I do think surgeons show a lot of empathy in a wide variety of situations, from first seeing the patient with diagnosis all the way through to after they've completed a surgery. So, for example, if you were assessing a patient in an emergency situation, having empathy for that person who is probably very frightened, is in a lot of pain, and is probably really worried about what's going on, showing empathy in that situation of, I'm here to help you, help understand where the pain is coming from. And also as well, understanding not just what's happening at that moment in time, but someone's maybe past medical history or their social history or anything that you think would be important in that situation to give the patient their best outcomes as possible. For example, not all patients would want surgery. Some patients are too elderly or too frail to go through surgery, and a surgeon needs to have empathy and understand that person's baseline situation to understand if surgery is the right option for them, and to make a collaborative decision with the patient and their family is really important. I think as well, surgeons obviously are going to perform surgeries, and surgeries are, I think, associated with risk majority of the time, and being able to communicate that risk to patients in an empathetic way is really important, again, for putting patients at ease and really respecting the patient's decision again. I think as well, it's important when, for example, in a surgery, if something goes wrong or if something is not followed correctly, things can happen in surgeries where it's not always the most positive outcomes. And I think being able to take responsibility and having empathy for the patient and their family, and being honest and having that rapport with them to explain the situation, be honest, and what you're going to do as a result of that is really important. So to conclude, surgeons should be empathetic. I think they use it right across the span of the jobs that they do for patients.
Describe a time when you overcame challenges when learning a new skill.
So when I was at school, I saw lots of people playing netball. My friends played netball and were on the team, and that was something that I really wanted to get involved with. And so obviously when you're new to a skill and to a sport in general, it can often be really challenging. I really wanted to be a shooter. I'd seen some of my friends shoot and thought that looked really cool and I want to try that. But I really struggled with the dexterity at the beginning, and I really struggled with the confidence. I think sometimes looking at all of my friends, knowing how good they were at it, and it wasn't seeming to come so naturally to me, it did affect me. and even probably made my confidence worse. So I thought to myself, actually, I have been enjoying this when I've been doing it, and it's something that I want to continue. So I really want to try and work and overcome this challenge so I can play with my friends and have fun. So what I did was I went home and I watched videos on shooting techniques, and also just watched videos of netball in general, and because I was really interested in it, and so that helped keep me motivated and overcome the challenge. And I also asked my friends if they could do some extra practice with me outside of school to try and listen to them and listen to the advice. And so as time went on, I got better and better. And so I then joined the school team, and I really enjoyed playing in the school team. And then actually I even took that further. I was on a lower team to begin with, and I really had aspirations that I wanted to play for the top team at school. And so that was another hurdle that I had to overcome. And that was, again, about putting in the hours and the practice and setting myself a schedule and holding myself responsible of, I'm going to do, say, 100 shots a day, and I'm going to practice and I'm going to practice, and I'm going to ask for feedback and ask for advice from my coaches and from my peers and go from there. So it was a really important time in my life where I really learned how to deal with setbacks and deal with challenges, whether that be from a skill point, but also from with my peers, feeling, sometimes you can feel a little bit inferior when it's your friends and when it's your schoolmates and you're maybe not doing as well as you wanted to. And I think it was really important for me in learning the really important skills of determination, which I think is really important in medicine. So in summary, I think me overcoming these challenges at netball, and specifically the shooting, have been really important to me, and I think will really help me as a medical student, where you inevitably will face difficulties and challenges.
It is widely reported that medical students have worse mental health than their non-medic peers. What could be the factors influencing this?
So I think this is really important to discuss, and I think I'll probably focus on three main factors: workload, responsibility, and the emotional aspect that is specific to medical students. So if we start with workload, it's associated with a lot of hours. You are on placements, 9 to 5, and potentially even night shifts, which tends to be very different from a normal degree where it's essays and library work. And I think that can really take a toll on people working those long hours, especially when you can see your peers or maybe having a more relaxed lifestyle, are able to go out and socialize a little bit more, whereas you have to prioritize your placement or your 8 a.m. that you've got to be in at the hospital for. And I think that can be really difficult sometimes to manage that workload, especially when it's very different from your other peers. So I think that could be one important factor. And also to do with the workload is a very emotional type of workload that's very different from any other degree. When you go into the hospital, you're dealing with very ill, very sick patients. You can be talking to patients about death. You can be informing family members about death, and they are highly emotional, very sensitive topics. And I really think that can take a toll on people's mental health, because being able to separate your workload and your studies away from your home and your personal life can be really difficult. Sometimes you've been at the hospital all day and you've dealt with some really sensitive issues. It's really hard to shake that off when you get home, when everyone else can have fun and maybe go out and socialize. Sometimes that's still playing on the back of your mind as you're getting used to working in a hospital setting, which I think can be really difficult. And also as well, I think the responsibilities as a medical student. You can be studying for 5 to 6 years, which is again very different from peers who maybe do the 3 years. It's a long time, it's a long commitment, and you have to be responsible for your own mental health, often for other people's mental health and for other people's safety. And I think that kind of ties in again with the emotionality. And so I think it can be really difficult as a medical student. And I think it's really important to acknowledge that and really support medical students and maybe signpost really protective factors that we could put in place for medical students. And I think those are things such as socializing and trying to, it sounds difficult, but separate that work-life balance, making sure that you're in contact with your peers. Fellow medical students tend to have really good camaraderie. They're all going through very similar situations. And I think being able to talk to peers can really help people's mental health. We obviously have our normal protective factors of our exercise and maybe meditation and mindfulness, but I think it's also important to signpost maybe other services such as university counselling services, if there's mentors at the hospital, or even doctors that have been in your position at some point. And if you need that helping hand, if you think they can offer you any advice, I think that's really important. So I think overall, yes, medical students can face some mental health issues disproportionately to other peers, and I think that is because of the nature of the workload, the emotionality and the responsibility that comes with being a medical student. But there is support out there, and I think it's really important that we encourage that.
You attend placement, but the doctor says he's too busy to teach you. He says he will sign you off for you to go home. How would you respond?
First of all, I would acknowledge the really difficult role of a doctor, particularly with the current status of the NHS. People and wards are understaffed. There's so many patients, and so often they do not have time to teach. They have to prioritize patients and patient safety first. And so I'd be really empathetic and understand the doctor's situation. So what I would want to do is I'd want to assess what I want to get out of that placement. I would maybe ask them if there is an alternative time that they have available for teaching that is a better convenience to them, and put that in place if I think that seniors teaching is going to be really important to me. But also, when you're on a medical ward, you have such a wide variety of learning opportunities and people available to you, which is an incredible thing. I could maybe follow a junior doctor and on a ward round and learn how to take notes and offer to help with jobs, whether that be doing bloods or taking people for scans or observing things. I think that it's not just seniors and consultants that can offer really good teaching. I think the juniors and helping you with jobs is really important. There's also nurses. You could go and watch them complete their observations on their patients and understand more about the physiotherapists or the occupational therapists and the important roles of them and how they collaborate with the doctors. So I think that's really important, is just seeking out the help where you think you would most benefit from the learning when there's so many people around you. I also think the library and textbooks are also a really important thing. We can't put things into practice as medical students without having the knowledge basis to begin with. And so if I didn't think that there was any opportunities to learn on the ward, I'd then take the initiative to take myself to the library where I could learn maybe about some of the conditions that I've seen on the ward that I'm maybe not too familiar with. Make sure I understand the diagnosis, what signs, what tests we can do, and what the treatment is and what medications we can give. So it's not just the practical jobs of the ward that we can get. I think having a really good understanding of the science and conditions themselves. So I think overall what I would do is ask if there is another opportunity for teaching available from that consultant or doctor, and then from then on target my learning based off what I want to get most out of that placement, whether that be practical skills, whether that be shadowing junior members, or whether that be taking my own initiative to go and learn more about a wide variety of conditions.
Are all healthcare professionals motivated purely by goodwill?
Goodwill to me is the desire to help people without nothing in return necessarily. I think it could be linked to kindness, selflessness. I think that's kind of in general what I think this question is suggesting. So I do think that it is a motivating factor for medical and healthcare professionals. I think being able to impact a patient's life is something that is incredibly rewarding. And for me personally, was a contributing factor into why I wanted to become a medical student. But I also think it's important to understand that it wasn't personally my only motivating factor. I think it's multifactorial. For me, the intellectual curiosity, the sociable nature of the job of you getting to speak to so many different people and such a wide variety of people, alongside the nature of being able to help people, is something that I think is really rare, and not many other jobs offer that such wide variety of factors. And so that's why I personally think I wanted to become a medical student. And so I think it would be also important to consider that life as a medical student and as a healthcare professional is not always going to be overwhelmingly positive. And I think it could be a little bit naive to think that everybody does everything out of goodwill and that everything is going to be great, especially with the status of the NHS, of pressures on healthcare professionals being understaffed and having so many patients and really long waiting lists. It can be really hard. So I think that's also important to consider. But also as well, that as a healthcare professional, it is a very stable job. For me, I quite enjoyed the fact that I would be able to see my career progression out in front of me, know that there are checkpoints and that I can work my way up through learning and through experience. So that's another thing that appealed to me. So whilst I think having goodwill and kindness and selflessness is a motivating factor in the majority of healthcare professionals' motivation for doing that, I think it would be naive to think that it is purely the motivating factor. I think it's multifactorial, and when we take into consideration people's personal lives and their work lives, I think it's not only goodwill.